which of the following is not a component of informed consent? So we're looking for which is not part of informed consent, meaning that 3 of these choices will be components of informed consent. And now informed consent, as we've seen in other questions, if a patient gives consent, that's like an okay, that's like agreeing to whatever the provider is suggesting, any sort of procedure. If the patient gives consent, then they are okay agreeing to this procedure. But in order to make a good, well-informed consent, meaning that they're not just saying, okay, yeah, let's do it. They're saying, okay, but they really are making the best choice for themselves, means that they have the right information to make that decision, an informed consent. So that means that they're giving all of the details, they're given any alternatives, any risks, any benefits, so that the patient, when they're agreeing knowing everything, because it wouldn't be considered a good consent if they weren't given this information. And then let's say the patient says, okay, I agree, but then they realize after, oh, I didn't know that I'd have this side effect, or, oh, it could cause a risk for that to happen. If I had known that, I wouldn't have agreed for it. So we want to make sure that our patients have all the information they need so they make a proper informed decision of what's best for them. So now that we know what informed consent is, let's look at the choices to find which is not part of it. So option A says a patient's insurance details. And typically the insurance isn't something that is always necessarily part of informed consent. Maybe if the insurance covers the procedure, knowing the cost is maybe something to decide if they want the procedure or not. But it's just saying details of the insurance. It's not saying about insurance coverage. It's just saying, oh, do they have Humana? Do they have Anthem? Do they have United Healthcare? So that's just kind of a characteristic of the patient's chart. So let's look at the other choices. Option B says possible risks and outcomes. And that's definitely something that you would want to include in an informed consent decision. You want to make sure the patient understands the risks and the outcomes, because that could change whether they want to agree for it or not. And that means that they have all the information of what to expect. So since that is a component of informed consent, we will eliminate option B because we're looking for which is not. Option C says explanation of the procedure, and that is definitely necessary for informed consent. If they don't understand what the procedure actually is, then they're not really making a true decision based on all of the knowledge that they need to know. So we will eliminate option C because the question is asking which is not part of informed consent. Option D says alternatives for the procedure. And that's definitely necessary because in order to make a good decision, they have to know, okay, well, now that I know there's some risks here, maybe there's some side effects, what else could be done? Is there something less invasive that maybe I would prefer? So the alternatives are definitely a part of informed consent. So therefore, we'll eliminate option D because we want to know which is not a component of informed consent. So we eliminated options B, C, and D. These are all parts of informed consent. So that leaves us back with option A, which we were considering, patient's insurance details, not necessarily part of informed consent. So therefore, option A would be the answer to this question.